आज ये 35th PMA academic webinar हो रहा है और प्रोफेसर मुलाजिम बुखारी, who is the principal of Azad Jammu Kashmir Medical College, he'll be talking about monkeypox, epidemiology, transmission, vaccine and treatment. So let's start with the recitation of verses from Holy Quran. I'll ask Professor Rashid Mahmood to recite few verses from Holy Quran.
Jazakallah sir. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. قل هل أنبئكم بشر من ذلك مثوبة عند الله من لعنه الله وغضب عليه وجعل والخنازير وعبد الطاغوت أولئك شر مكانا وأضل عن سواء السبيل صدق الله العظيم. तर्जुमा, ये कुरान पाक में बंदर का जिक्र कम से कम 3 मरतबा है जलील ख्वार और सूर से मुकाबला करके। मैं इस आयत का तर्जुमा पढ़ देता हूँ। कहो कि मैं तुम्हें बताऊं कि खुदा के यहाँ उससे भी बदतर जजा पाने वाले लोग हैं। वो लोग हैं जिन पर खुदा ने लानत की और जिन पर वो गजबनाक हुआ और जिनको उनमें से बंदर और सूर बना दिया और जिन्होंने शैतान की परस्तिश की, ऐसे लोगों का बुरा ठिकाना है और वो सीधे रास्ते से बहुत दूर हैं। सदक़ल्लाह।
Jazakallah. Before we start this webinar, I'll ask everybody to mute themselves so that we don't get disturbance. And on behalf of PMA, on behalf of Azad Jammu Kashmir Medical College, and collaboration of Women Medical College, Epidemiology, I'll request Professor Mulazim Bukhari to please carry on with your presentation. It's a very important topic, very pertinent, and nowadays we are facing the threat of monkeypox. So we'll be hearing you from him. Thank you, Mulazim Bukhari sahab. Please carry on.
Thank you very much, Professor Qazi Sahab, Dr. Qazi Sahab. After I think 1 or 2 months, we are restarting our webinars. This is basically academic activity, purely academic activity, and nothing present in this activity, any political or any other issue. And inshallah, we'll weekly continue this one. Nowadays, we are facing another threat. The government of Pakistan has warned the peoples because nowadays this is becoming this monkeypox is becoming prevalent in non-endemic area. I will discuss everything. And very luckily, just I was talking with NIH Major General Ikram. I asked, is there any confirmed cases in Pakistan? He said no. Another question I asked from the Major General Ikram, is there all PCR facilities, diagnostic facilities available in Pakistan? He told yes, the Pakistan is ready to face any of the threat from the monkeypox. Just you all know the monkeypox, that this disease was first started in 1958 in the monkeys and other animals in the Africa. And in 1970 and onward, the cases were seen in endemic areas, not in non-endemic areas, in the Nigeria and in the Africa. But nowadays, from the last 2 years, in 2019 1920, 1921, and 1922, the cases are being reported in the endemic, non-endemic areas. This is not a new disease. This disease is a little sister of the smallpox, and the same virus almost genus belongs to the Orthopoxvirus. You all know that the smallpox was once pandemic in Pakistan when we were in class 4 or 5. Anyhow, now after the vaccination of the smallpox, it was completely eradicated in 1970 and 1980. After that, not a single case was reported in Pakistan in the world. So that is why the vaccination was not in the same way was given to the people, but the people who are now at 40 and 30 and above, they have not taken the smallpox vaccination. That is why this new virus is attacking them. So basically in the first slide, this is a zoonotic disease, and it is spreading from the animals to the humans, and now humans to the humans. Same the corona, we saw that this was also a zoonotic disease, and from zoonotic disease, then it mutated and became the human one. We are also afraid. This is very simple way that how it started from the rats and from the monkeys, and with their close association are their scratches, their bites, the consumption of their uncooked meats. This is transferred to the human, and from human to human, we will discuss in detail. This is now the latest data in the world, around about more than 100 cases. This is the list in this area. You are looking the confirmed cases, suspected cases, and very interestingly, that in America, this is the case of the non-endemic area, but this was sorry. Sorry, this in non-endemic area now it is increasing. Australia, Belgium, Canada, France, Germany, Italy, Northern Netherlands, Portugal, Spain, and most commonly that is the important case that can come in Pakistan, that is the United case, London. We heard that one case came in Pakistan, but that case was not confirmed. This is the presence of 28th May 2020, that about 21 countries in the world. That is why the WHO is warning, and that we arranged this webinar to create the webinar, that you should be careful, because the corona has told that we must be careful whenever there is any threat of this one. If we are aware, we can control this disease. So the pathogens, I discussed this is the same virus that was belonging, and this virus is divided into two parts. One is the Central African part, that is, and other is the West African part. The West African part is more dangerous. The mortality is more in the West African as compared to the Central Nigeria and other things. While this is only one country in the Cameroon that contains both type A and type 2, this monkeypox virus. Various animal species that we will discuss one by one have been identified, and these are like these squirrels, these rats, these monkeys, these animals. So these are the animals that are responsible for spreading this one, because these animals can be in contact with the humans. How? How can they spread from humans to the animals to their blood, their body fluids, their contact with the cutaneous, their hairs, their especially very important is that some people, if they are taking the uncooked food, meats and animal products, they should be very careful that this disease can be spread to the humans. And if once in the human can spread to the other areas. The people living this is the WHO report that this people living in the Africa, more in the forest area, they are more prone to suffer this disease. So very important that interestingly, this is very interestingly first time see that the more commonly seen until now 20 or 33 cases, they are homosexual. That is very important there in the UK. One person came from the Nigeria in the UK, and after that, now around about 33 cases are reported. These all cases are males, not a single case now seen in the female, but they can spread from the male to the female. And other source of other way it can spread, yes, from the respiratory tract infection, from the physical contact, from the skin disease. So this can be similar. I will request other people to mute their mics. Please mute your mics. So there is another way can spread from physical contact to the droplet infection and contact to the skin, human to human skin. And very important is that people who have low immunity, diabetes, autoimmune diseases, vitamin D deficiency level, and the people who have not taken the smallpox vaccine. As I told you that after 1970 and 1980, when there was complete eradication of this smallpox, there is no trend to get the smallpox, even in not in Pakistan, all other country. That is why this disease is spreading. Now, can this disease spread from the pregnant woman to the baby? Yes, this virus can spread through the placenta, but the good news is that it cannot spread from the breast milk. What are the signs, symptoms? Incubation period is 5 to 21 days, but it can prolong for the 4 days. This depends upon the type of the virus. Either it is Central virus, Central African virus, or it is the West African virus. Usually the symptoms starts after 5 days. And very important thing is to differentiate this disease from the smallpox disease and other diseases. The important thing is that the fever is common in all other diseases, headache, intense headache, but very important thing is the lymphadenopathy. This lymphadenopathy is the only important thing, that the cervical lymph node are enlarged, the axillary lymph node are enlarged. These lymph nodes are not enlarged in other diseases. So these are the different, when a patient comes to the physician must take the history and take the clinical examination and concentrate that if there is no lymphadenopathy, then he can suspect the smallpox, chickenpox, measles, and skin allergy and the drug allergy and other diseases, very mimicking to this disease. So 99% of the patient, this symptom we divide into two parts. One is the acute phase. In acute phase, you will see as I told you, the fever, the headache, the myalgia, the backache, the lymphadenopathy, and the tiredness. And while in the second phase, that second phase is called the eruptive phase. The eruptive phase means you will see the eruption on the skin. These are decided. First of all, there is the macules, the reddish macule. This starts appearing after 3 to 4 or 5 days of the fever, of the onset of the disease. But once again, I will let you know that these symptoms depends upon the immunity of the patient. That is why we concentrated in continuously in our webinars, we are telling you that you keep your balanced diet, you keep your normal level of the vitamin D, you keep control of your blood pressure, you keep control of diabetes, your diabetes and sugar level to maintain at this well. After 1 day, then there will be papule, then the vesicles are filled with the fluids, then the pustule filled with the pus, then the crust and the scales. So this is the stage is how it was, how it appears after. Another good news is that this disease is a self-limiting until and unless the patient is suffering with the immunity problems and the children's. That is why the death rate as to mortality rate is low as compared to the smallpox, but 3 to 6% in the Central African monkeypox, while it is up to 10%. I was reading the literature in the John Hopkins that they are expecting more than this, more than 10%. And I was also reading a literature that among 33%, 3% has died in the UK. So it is, it can become aggressive. So what are the different complications? Is the secondary infection, bronchopneumonia, sepsis, encephalitis. And if the patient is suffering from the fever and the fever is not settling, it means the patient is going in the aggressive phase. Then pneumonia, most of the deaths have been reported due to this pneumonia. So be careful when a patient of this one. You also use the mask, the doctor must use the mask, and that again washing of the hands, again keeping the distance. These are the same measure that the corona has taught us. That is why it is very important for the doctors that if they do not know that either the monkeypox is coming in the globally, because now the world is globally, if any patient appear in any area can come in Pakistan. And you know the Pakistan is the most populated, almost fifth and sixth populated country of the world. So these are the symptoms that we described in our previous picture. This is the acute phase, and that is the second phase, that eruptive phase. This is the vesicles. This appear after 5 days, and then this is the second phase. Then a vesicle becomes pustule. This you are looking here, the ulcers, and this is you are looking at the pus, the pustule, and after that this becomes scaly and crabby. I think this patient was reported from Pakistan in the social media on the 21st May. First patient of this monkeypox was reported at the 4th May in the UK. This person was reported in Pakistan, but I do not think that he has not taken the PCR. And what was his confirmation? According to the NIH, there is no patient of the monkeypox in the Pakistan. Again, this is very important that how you will diagnose the case. First important thing is the history, clinical examination. When the doctors are going to do, or medical students are going to do the clinical examination, they must wear the mask, and they must wear the goggles, they must wear the gloves, and they should be very careful in keeping away from the droplet infection and contact. And after examination, they must wash the hand about 20 minutes of the hands. So the diagnosis is almost same. After making the diagnosis, that is very important thing is that is the PCR. But the sampling technique is very important. Doctor must supervise the nurses and other technologists in taking the sample. If the sample is not appropriate, the report will be negative. Another important thing, the WHO reports that when the sample is appropriate and you are not transporting safely, this not only make the danger of the spread, but the report may be negative. So that is why, again, the type of the specimen, if you are taking from the pustule, taking from the vesicles, if you are, how much you have taken the specimen, and what are the tests you are going to be performed. in the lab, PCR or something else. That is, these are the important precautions in making the, so PCR, when the taking the PCR, the doctors, the physician, the consultant, the general physician should supervise that the fluid, that you take the sample from the roof of the vesicle or from the fluid of the vesicle, from the pustule, fluid of pustule or the dry crust. And but do not take surrounding area, other area that may be possible. Another thing is the biopsy. If the crust is there, you take the biopsy, but the option, do not put the formalin in the specimen. You only store in a sterile, sterile tube and send to the lab. That is why to make it the, so another very important thing, do not send the blood, do not send the saliva, do not send the semen, do not send the anal swab, because the viremia is very short duration. That will make it the negative. And if the report is negative and the patient is positive, that may false positive, false negative, that the danger is to spread the disease in other area. Another recommendation you are looking nowadays, the companies are telling you that antibody, antigen, or the serology test, these all are fake. Do not trust on this one. Only and only test is the PCR, and the PCR should be taken. That is this is another false positive. If anybody has taken the vaccination of the smallpox, that can give the positive. So the history before taking the specimen, or this all history should be sent, that's submitted to the lab along with the data of the age and the gender and things. So if the patient should, that is why the PCR, making the PCR, we should know that the patient has taken already the. So another information you submit, the when you are going to submit the sample in the fever stage, it may be negative. In the rash stage, it may be negative. The only thing when the vesicle, the pustule, the crust, and other thing, then the PCR may be sample. The collection of sample is very important. No, this was the diagnostic, important precaution of the diagnosis. Another thing, the precautions. Prevention is better than, as with Pakistani people, we know when we stand against any of the disease of any of this, we saw how we prevented the transmission of the corona and even the mortality of the corona. That is why my request is that you, if any of the person in Pakistan is there, first thing is that the general public awareness, then is the health caring bodies should be ready to handle this situation. And if some patients are coming in the Pakistan, then the solution is the vaccination. The vaccination is, I will let you know what is the name of the vaccination. So this is the vaccine, same vaccine, the smallpox vaccine, genus vaccine. These are the 2 doses vaccine after the 4 weeks. The immunity is only confirmed after the 2 doses. Yes, if you see the score, if you all people like of my age, there will be score on this arm, upper arm, that when we were in class 5, this smallpox vaccination was given to us. The smallpox vaccination is still effective about 85%, because I told you earlier that this is the little sister of the smallpox virus. The people in this new vaccine was introduced, that is called the Ankara strain in 2099, but still its side effects and its profile. Another important question is that when this vaccine is given, either can we give this vaccine to the patient? Yes, this is the only vaccine we can give to the patient to enhance the immunity, and other is to give this vaccine for the prophylactic purpose. This is the procedure to give the vaccine in the upper arm. And again, I am mentioning, give the 2 doses after 4 weeks. Same, we are feeling the problem in the corona, and in this vaccine, because this is the DNA vaccine, no booster is required. While in the corona vaccine, we will need the booster every year, because the corona is changing, mutating, while this virus is not mutating, because the mutation is very slow in this virus, because this is the DNA virus. What should be the country do? The surveillance and the rapid sorry,
Kazi sir,
sorry, there was interruption, and we have seen awareness is
सब नहीं आते.
I am sorry, Qadi Sahab. I think the problem is on where is it? Because I have. Okay.
Oh, you are on.
Yes, we were
Great.
discussing the prevention. In the prevention, first thing is the creating the awareness, and the governments and the other institutions and NGOs must do the surveillance and share. The countries should share the information, so that we should know what are the different risk factors of this one. The educating the people about the measures they can take to reduce the exposure to the virus in the main prevention. And the policy makers should provide the vaccine that this disease can come anytime in the Pakistan. And if any one case is there, then we should go for the vaccination. One important thing is that the question is either this, if you are vaccinated or I am vaccinated, can I get the monkeypox? No. If I am completely vaccinated in the childhood, there is no danger of this virus again. Only the people of the 40 years who have stopped the vaccination since 1970 and 20, they must get this one disease also. So another thing is that we must reduce the transmissions, handling of the patient, handling of the specimen, laboratory worker especially, and the people who are living with animals. So the transmission can occur through the humans to humans. The transmission can occur from the animals to the humans, and transmission can occur in the doctors from taking the examination, doing the examination, and transmission can occur from the sample collection, or transmission can occur in the laboratories who are doing the PCR. So these are all measures that can reduce this transmission. Is there any treatment? Yes. First treatment is symptomatic treatment, that to reduce wash the patient, quarantine the patients in the home, and almost quarantine the patient around 21 days, and give the symptomatic treatment to not only to reduce this disease and to reduce the complication, and keep the patient on the fluid and good diet and good vitamin D level, and try to to reduce the risk of the secondary infections. Is there any drug? Yes, there are 3 antiviral drugs, but this drug is very commonly used with good safety and low complication and good tolerance to renal tolerance. And this, the name of this is teicovarum. But I will request not to use your own self. You consult your doctors and consult your consultant that he will adjust the dose and he will adjust that is this drug is required or not required. But for you should know that drug is available and very effective antiviral teicovarum. This is now being used in UK and being used in the Europe, and the demand is increased. No doubt, we all are complaining that they become costly. They are becoming costly everywhere, because when there is demand is high and the supply is low, there will be some malpractice. Another drug, these are the two drugs. These are the two drugs, pseudofovir and bric-pseudofovir. This pseudofovir, the safety data is not available. The tolerance, kidney tolerance, renal tolerances data is not available. While bric-pseudofovir, this is a new drug they are now introducing in the endemic area. They are not going to use in the non-endemic area. While immunoglobulin, these are used to people who are autoimmune, suffering from the autoimmune diseases, or the immunity is low. But once again, there is important thing is that there is no danger in Pakistan. Now I will summarize this. The summary is that the Pakistan, there is no one case in Pakistan. And second message is that all the diagnostic facilities, PCR, are available in the Pakistan. And third is that this is the zoonotic disease. And fourth, that this is nowadays can spread from human to human. And I hope that we should be very careful. If any of the case comes in Pakistan, we should adopt all the measures we are adopting in the COVID. Thank you very much. And if you have any question, most welcome.
Thank you, Professor Bukhari. It was